Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is the intersection of mental health and cancer. On the last episode of Warriors Talk, I discussed celebrating survivorship. You can head on over to YouTube, type in intellectual radio, and stay connected for any episodes you may have missed. The quote of the day is, you have to be willing to give up the life you plan and instead greet the life that is waiting for you. And that quote is by Joseph Campbell. Here is your trending topic for today. According to CBS News, Vice President Kamala Harris is riding a wave of voters' enthusiasm into the Democratic National Convention that has transformed the race against former President Donald Trump 3 months before the election. The 4-day convention is taking place right here in Chicago today, about a month after President Biden ended his reelection campaign, as the growing number of Democrats question his ability to handle the duties of commander in chief for another 4 years. The Democrats quickly united behind Harris, who named her, excuse me, who named Minnesota Governor Tim Walz as her running mate. This year's convention is held right here in Chicago, a Democrat stronghold. Last hosted the nominating convention in 1996 when President Bill Clinton was running for re-election. Events will be held in two venues: at the United Center, where the speeches and other events will be held in the evening, and the McCormick Place, which will host parties and businesses meetings during the day. Chicago is not the battleground state, but the city is about an hour drive distance from Wisconsin and Michigan, the two battleground states that are likely pivotal to the Democrats' ability to win the White House in November. Wisconsin and Michigan, both considered blue wall states, have historically supported Democrats, but went for President Donald Trump in 2016 election before President Biden took them back in 2020. What you can expect to hear from Vice President this week is going to be a message about moving the country forward, about an opportunity of economy where everybody in the country feels like they can get ahead, where corporations are held accountable, where people know that they have an even shot with the rest of the world, she says. And she's talking about moving the country forward and not backwards. That is your trending topic for today. I am so grateful for my special guest today. She is definitely not a stranger to Warriors Talk. She is our healthy solution expert. She has over 20 years experience as a family physician, and she is impacting lives every single day. Welcome to Warriors Talk, Doc Michelle. Hello.
Oh, hello, Lady Michelle. How are you today?
I'm good. How are you?
I'm good. I'm good. Happy Monday. Let's get this week off started right.
Yes.
Yes.
Yes. I'm excited. At least
Yeah.
it was a nice day today. So um,
No.
I'm
It's
excited
beautiful
that
outside.
it's very beautiful outside. Considering the last couple of days, it was didn't know if it wanted to rain or be cold. So,
Right.
you know, we can't complain in Chicago because we know how crazy the
No.
weather can get. So
Yes.
um, I'm excited
Wait a
about the
few
weather.
seconds and the weather will change. So
Yes,
that's what's happening.
that's so true. So today's topic is the intersection of mental health and cancer. So if you are tuned in on any form of social media, like the show, share the show, invite someone else in on the show that you feel may benefit from this valuable information. So Doc Michelle, mental health right now, I know it's a big thing right now. At one point in time, we very rarely talked about mental health. I mean, the conversation was kind of hush hush. You may not even known someone was dealing with mental health. But I think lately, over the past few years, or maybe since COVID, that people have been vocal about their mental health and how it's affecting them. And I think it's allowing other people to be open as well.
Yes, yes, so true, all of that, right? Because for a long, long time, there was a stigma associated with mental health, and people would suffer in silence, not go talk to their provider, get treatment, talk to a therapist or anything, right? And so I think, like you said, maybe since COVID, things have changed a bit where people are a little bit more open about talking about their mental health, and also because even celebrities are now talking about their mental health, right? We just came off the Olympics with Simone Biles. Previous Olympics, we know Michael Phelps, the singer, the swimmer, has been diagnosed with depression, and he was open about that. You know, DeMar DeRozan for the Chicago Bulls has been open about talking
Mhm.
about his mental health and depression. And so I think that that makes people feel a little bit more comfortable about talking about their own mental health, and really just knowing that, oh, it can happen to them too, right? So that stigma is slowly lifting, and people are being a little bit more open about talking about it.
I totally agree. I was just thinking about like, how do you address mental health, especially like if it's within the family? You know, a lot of times we don't like to talk about things that are happening in the family, but then sometimes what's happening, if someone's dealing with mental health, it can affect the family. It could take a toll on the family. So how do someone even begin to address mental health, and then on top of that you throw in a cancer diagnosis or any type of diagnosis?
Right, right. Yeah, so the first thing is, if you notice a change in someone close to you, is to not pretend it's not happening and think, oh, maybe they're just having a bad day. But if you're noticing something where you day after day are thinking about it, the easiest way is to say, "Hey, Susie, you seem kind of sad today," right? And so sometimes I don't use the word depression because again, there's a stigma, right? So I choose my words wisely when I'm talking to either family members or patients, right? Miss Jones, you seem, really sad. The last few times I've seen you, right? You didn't seem very happy, or you seem angry, right? Because mental health may come in different ways, or you don't seem like yourself. And sometimes that might open the conversation, or we can always acknowledge that it's I know it may be difficult to talk about it, right? But it's not uncommon for anyone who has, if they have cancer, right? It's not uncommon for anyone who has a chronic illness or cancer to feel down and depressed. Does that seem, like how you feel most days? But being, conversational about it, and making it a part of just, I care about you. So I want to just, not ignore what I'm perceiving, and address it.
So the way that you would encourage someone, like if your patient, you feel like, oh, there may be something going on here, like how would you encourage them to seek mental health support without them feeling like the stigma is attached to it? And I know you mentioned the word using sad versus depression, which is a big thing because I think when people hear depression, it just some just clicks and be like, I'm depressed.
Right,
There's nothing wrong with me,
right.
knowing that, there could be something going on. So I know that's
Yeah.
one way is the choice of words, how you address someone.
Yes, yes. So a couple of things from a physician standpoint that we do, right? So I might start with that conversational sort of question. And then I would say, hey, can I ask you some questions that I would ask anyone that I'm concerned about, right? Because we have a list of questions and criteria. And depending upon those answers, I might say, have you ever thought about talking to someone about how you feel? Right. And I always again, I make it that it's not a stigma. Everyone can use someone to talk to, right? And so have you ever thought about it? If they say no, I say, hey, sometimes, it's good to have someone to talk to that really can just listen objectively and give you some tools to help handle that stress that you're going through, or the depression that you may feel, right? And it can be very helpful because I've had other patients who've had really good success with that. And so I always also will say that, why don't you give it a shot and see how it makes you feel, right? Nothing's permanent. I always, tell a patient they have autonomy over the decisions that we make,
Mhm.
right? With them. So nothing is written in stone, but hey, give it a shot and see if it works for you and starts to give you different ideas and different tools on how to work through your stress and depression and sadness, right? There's always a place for therapy, and then there's always a place for medications depending upon the diagnosis.
I could
But really,
remember. Go ahead. Go ahead.
yeah, but addressing the stigma and making it normal, to talk to someone, to feel sad depending on their situation, is the best way to go about it as well.
Yeah, I could remember, Dr. Michelle, when I had, hey Lisa, when I had my last child, and the pregnancy was, it was a traumatic pregnancy. It was a lot, because I was diagnosed with the blood clots, like right before I got pregnant with her, and the doctor said, "Don't get pregnant." And it seemed like as soon as she said that, it was like, oh my God, I was pregnant, but I had been taking the blood thinners. And then, I was told that the baby could have some deformities. You may want to think about, you know, maybe raising a baby that may have, issues, or you may want to think about getting rid of the baby. So there was a lot weighing on me just from that. And so I would just remember my doctor, like after I had the baby and everything, and she's okay. She's 12, and she doesn't have any
Wonderful.
issues. But I just remember my doctor just noticing that I was feeling just not my usual bubbly, talkative self when I be in her office. And so she did ask, like, "Are you going through something? What's up? What's going on?" And she, went shot a series of questions out to me and say, "Hey, if you would like, I can, have prescribed, this. It's totally up to you, And I opted not to, but she did check to see, what was going on just from our interactions, and then knowing the situation that I went through. So I think that's important, because a lot of times,
Yeah,
we don't have a lot of time when we're in the doctor's office. And if
right.
we can get in there, and I think that's why it's important to have a relationship with them,
Yes.
just
Yes.
be honest about what you're going through, so that they can have the tools they need to, okay, let me see how I can help.
Yeah, and you made a good point because the fact that she knew you well, right? She could see the change in you. If it was someone that maybe, they weren't going to a doctor regularly, the doctor may not think it was a difference. Maybe you're always quiet, right? But it's not, it was really a change for you. And as you said, we ask certain questions, right, that will prompt us to say, well, maybe you do need to speak with someone, or maybe you're at the point where you do need some medication to help, because we know that depression specifically is a chemical imbalance in the brain of dopamine and serotonin, and that's why there are certain medications that put those certain neurochemicals in balance and make people feel better. Um, Certainly, if you have a serious mental illness like bipolar disorder, schizophrenia, other ones, borderline personality disorder, or something else, you probably need medication, right? There's a place for therapy there, but really, medications help to stabilize the mood disorders like bipolar, or the psychotic disorders like schizophrenia. And then there's certainly those things would be more even easier to diagnose than depression, mild or major depression.
Wow. I'm surprised that when I was going through the cancer journey, my oncologist never asked if I was feeling that type of way, or even if I needed to talk to someone.
Yeah.
And I felt like she was very attentive. Like she was, I mean, whenever I would go in there, she would always like ask how I was feeling. But I mean, it was never brought up to say, do you think you need to see? And maybe she didn't see any of that in me, because I mean, I going through it, I wasn't depressed going through it. So So she probably didn't see it. I mean, I was seeing her every week, so
Right.
I'm sure she would have probably picked up something if something was going on. But I just feel like it should just be the standard care with you going through. If you give me a prescription to do chemo, another prescription should be okay right after you do the chemo or before you do the chemo. Your next appointment would be with a
A
therapist.
therapist. Yes, yes,
Gosh, you really
yes.
do need it. Like, you really need it. I was looking at the statistics. Up to 25% of cancer survivors experience symptoms of depression, or even the 45% with the anxiety. We know you have the anxiety from, the unknown, the treatment and stuff you have to go through, not knowing how your body is going to react to it. Or just getting a cancer diagnosis can be just depressing in itself. And
Yes,
although most of people, to my knowledge, that I know of, don't stay in that depression, but it still should be addressed. I think it still should be addressed. Even if it's a
absolutely.
short period, it still should be addressed.
Yeah, absolutely. That should be a standard part of the history taking and questions that your cancer specialist is asking you, right? Are you nauseous? Did you lose weight? Are you losing your hair? And, do you feel sad, depressed,
Yes.
anxious? That should
Yes.
all come along with it because it is a life-changing diagnosis, right? And there's some studies that look at whether having depression increases your risk of cancer or affects your survivability,
Yeah.
along with the other way, right? And
Yes.
there's some studies that show that if you have untreated mental illness, that might affect your survival rate. And so again, very important to ask the questions for providers, and if you notice something of a family member or friend, to bring that up, right? I always tell patients too that don't always go to the doctor alone, right? Take a
Yeah.
trusted friend,
Yeah.
right? Because
Mhm.
they may bring up some things that you may not, and different concerns. But there are some cancers that, as I was doing some research, they said lung cancer has a great risk with depression, right? So people who are
So,
depressed, yeah, more likely
yeah.
to increase their risk of lung cancer, also GI, breast cancer, uterine cancer. So it's important to know that there is that link, and that it's important to address it.
Yes, I also saw that they talked about the suicide rate, but you mentioned about it being a risk factor. So I did hear that it's a risk factor to cancer, mental health. So if
Yeah,
you have mental issues, it's a risk factor. So it puts you at risk. So it's important to address it,
that's
manage
right.
it, get it under, management so that you won't have these issues.
Yeah, yeah.
The issues won't bleed over into your cancer diagnosis.
Right.
Is what
And that and they continue to do studies on that, because is it that when you're depressed, right, you have more stress hormones like your cortisols that are triggering something? Is it that when you're more depressed, you are engaging in behaviors like smoking and drinking, right? And we know those things increase lung cancer and other cancers, right? But again, knowing that means it's important to address it, for sure.
yeah. So cancer survivors are twice as likely to die by suicide than the general population.
Yeah, because people, and you can speak to this even more so, right? So cancer survivors, everyone thinks that, oh, you should be so happy to, have gotten through your cancer and everything, right? But there's a lot that comes after the treatment as well, right? So certain things like maybe because you're now a cancer survivor and you've gone through your treatment, the same supports that were there when you were going through treatment are no longer there because everyone thinks you're doing fine now, right? And maybe just going through, because we know certain medications can affect your hormone levels and make you feel depressed. And so you may still feel depressed after you've gotten through your cancer treatment and have, quote, become a cancer survivor, but you might feel like, well, I'm still feeling kind of down, right? What's wrong with me? And if that's not really addressed, then and left
Mhm.
untreated, then you get that suicidality.
Yeah. Kenya said, wow, that's alarming. It
Yeah,
is. It's scary, but I believe it. Like I totally believe it. And I could see it because of the unknown,
yeah,
just not really knowing, and because of all the things that we've heard about cancer, we associate it with death all the time, and that's the reason why I like to highlight survivors. I like for people to hear their stories, to give them hope, to know
yeah.
that not every cancer diagnosis ends in death. I mean, we all gonna die
Right,
from something, but that, it
right,
does, all of them does not end in death.
right,
So, and the part that you mentioned was just a very valuable part about having that support. It's almost like you in this big old tight hug, and everybody's checking on you, bringing your stuff, doing this, and then as soon as you're done, and the doctors release you, I always describe it as you're on this ledge, and the doctor say, okay, I'm done, and just kind of push you off
right,
the ledge, and you're hanging
right,
like, wait a minute, what just happened?
right,
And I do, and I agree with you. I do feel like we don't put enough into the survivorship. And I know some facilities, some places have survivorship plans, but I don't think it's enough. I think every time you're done with treatment, there should be a plan. And yeah, they have plans. Like when my doctor, I was seeing her, I think I was seeing her every 3 months, then every 6 months. And then it got down to my year. Once I hit that 5 years, she was like, you got to go. And I
right,
didn't want to go. And she was like,
right,
you got to go. You've been doing well. Like, you got to go. And I'm just
right,
like, and I felt nervous because as long as I was going to her and they was checking my blood, checking levels,
right,
doing whatever, then I felt this sense of security, you
right,
know. And now I have to be proactive and do these things on my own. If something is happening, I have to be proactive to say, let my faith override my fear and go in and see
right.
about it. Don't deny it, but verify it. So yeah, I feel like we don't put enough into after you're done, and that could be depressing. That could set you off into a spiral.
Right, right. Because yes, you're thinking like, okay, so what now, right? Am I still at
Yeah,
risk for recurrence, right? And
yeah,
what do I do now? How do I make sure, that I'm not? And so, and I don't know how many cancer groups do this, but when you're sort of done your treatments and such, do they still link you with nutrition therapy? Do they
no,
link you with other,
nothing,
survivors,
no,
and things like that? Yeah,
no,
I didn't think that was a
no,
norm. Right,
no. And I think that's why it's important for organizations like Warriors Talk, organizations like Kenya with We Care To agency, and we do stuff like that. And the Equal Hope agencies that are out there, like those are things that we do. We stay connected with survivors. Like most of the things that I've learned about my diagnosis, I've learned from other survivors. I'm just like, oh, they like, you could do this. I'm like, oh, I didn't know that. Yeah, you can get that for free. It's on your insurance. It's part of your insurance.
mhm,
And I'm like, oh, I didn't know that. So what do? I
right,
pass on that information to somebody
right,
else because I didn't know. And I know the doctors can't tell you everything, you know, like give you a list. Okay, this is what's going to happen, like everything, because everybody
right,
diagnosis is different and you don't know who's going to experience what. But I just feel like there should be, because you had a cancer diagnosis, there should be a closer monitoring to me,
mhm,
especially
mhm,
like since I was diagnosed. I think Kenya was diagnosed with that triple negative, more aggressive. It's more likely to reoccur. And
right,
so you just sent us out here, and we're just out here. And I was
right,
asking my doctor, like, well, do I need to take, some tamoxifen or whatever? She was like, no, your cancer was not hormone fed. No, it was
right,
triple negative,
right,
so no, you don't need to take that. I'm like, well, what do I need to do? What are you going to put me on? She's like, nothing. I'm like,
nothing. And
What?
that's scary, right,
Yeah, because I feel like at least if I was on something, I feel like something is working in my
right,
body to not make this
right,
cancer come back. And even asking her about scans, I'm like, okay, how often am I going to get scans? She was like, no, we're
right.
not going to be sending you for unnecessary
Necessary, yeah,
scans, you
right,
know.
right.
And she she just told me, like, if you have any issues and if it's lasting longer than, like, say 3 weeks and whatever, then you should be going to your general doctor. The general doctor should be
Yes.
checking it out. And then if need be, they'll run whatever test they need. And if you need
Yes.
to come back to me, then if not, the general doctor will solve whatever it is. And I was just, it made me so nervous,
Right.
but it also, Michelle, made me more proactive in my health. And although I still get anxiety when I go to the doctor, my heart rate is always up, my blood pressure is up because I'm nervous. And I'm
Right.
like, okay, they're going to find something. They're going to tell me something. But I know that I still need to go
Right.
because if cancer is coming, it's not going to stop growing because you ain't going.
Right.
You know,
Very true.
it's going to do its thing.
Right. Exactly. Exactly. So yeah, all that is very true, right? Even after you've gone through the treatment, the fear, anxiety, depression can be ongoing, right? And what you guys are doing with the support and network for the survivors is so key because yes, you learn from each other, right? You support each other, and you talk about your stories, and that's empowering for you and for anyone else that is listening. And so that's so great and wonderful because that is a group, the survivors that also need that continued support when all those other resources that you were getting from your provider office go away. You still have that support network. So kudos to
Yeah.
you and Kenya for doing that and keeping that network going. Because yes, the mental health and cancer intersect greatly, as well as with other chronic illnesses, right? People with chronic illnesses can also have depression.
Mhm. Yes. Kenya says badly with the unknown. It's so true. It's so
Yes,
true.
yes,
Um, she says, I thank God for the sisterhood connection. I'm telling you, I've learned so much. Because I know Kenya she's connected to, I think it's UIC, and it's just a lot of information that's filtered through there that you probably wouldn't even find out because we're not really getting it from our doctors. And I feel like we should be armed when we leave
yes.
that office, when we're done with treatment. We should be armed with something other
And
than you're done.
yeah, and for African American women, we always talk about the increased risk, right, and the increased mortality in African American women who get breast cancer, right? Whether that is because the disease is diagnosed later because we're not getting mammograms regularly. And that's another thing that you guys do through your network is talk about the importance of mammograms and self breast exams so that if you unfortunately get cancer, you get it early. And so your survivability is best, if it's caught early. So
Mhm.
that's another piece to this, right? Is making sure that the work that you are doing is affecting the broader population and African American women specifically who tend to have worse disease and more mortality from their cancer.
Kenya said, but they fail to realize that you need this to ease your mind.
Yeah,
Mm,
yeah,
we do. We
yeah.
need, yeah.
The close follow up and
Yes.
the
Yes.
scans, and with triple negative it's just hard because there's it's not hormone responsive, so all the things you hear about that
Right.
other women are taking, you can't, right? And so you do the other things that we always talk about on your show that can help to decrease your risk of cancer, right? Which is eating a good nutritious plant-based diet, making sure you're exercising, making sure you have a healthy body mass index and you're not obese,
Yeah.
not drinking alcohol, all those other
Mhm.
lifestyle things is
Yeah.
where, the control is.
Yeah. And I get upset at that, Dr. Michelle, because I was doing all of those things before. And this happened. And the only thing I can think of that would have allowed my immune system to be compromised is because I had the stressful pregnancy right before my cancer diagnosis, because I had her I had her in 2012 when I was diagnosed in 13. Like I said, I had her May of 2012 and I was diagnosed November 2013 and just finished breastfeeding her in July and then
Right.
November,
Mm.
you know. So, um, and I still do those things now because anything that I can do to be proactive, especially, I think we underestimate, and I always say we underestimate the exercise piece, which
Yeah.
plays such a big role in um, decreasing our risk of cancer. And it's something that we can do in the comfort of our home. And even the eating part, just
Right.
taking it one day at a time.
Right.
Think about what you're putting in your mouth. Um,
Right. Think about, yeah, that. But
yeah,
with cancer, we I think cancer expression is a multifactorial thing, right? So we can't say this one thing causes cancer, right? But it may
right,
have been if you have the cancer gene, but then your body is stressed from a stressful pregnancy, and there's other things going on that allows that gene to now express itself as cancer, but we always talk on your show about do what you can to at least decrease your risk. There's a few things that we can say there is zero risk. I can't think of any right
right,
now, right?
right,
There's no zero risk, but
right.
it's just, what do your part to decrease your risk as much as possible.
Exactly. Lisa said, my experience was different. I was excited not to have to go back to the doctor. In fact, I really dislike going for the follow ups, but I go. For me, once God told me I was healed, I took that information and I and I ran with it. Come on, Lisa. She
Awesome.
said, I told people that I'm healed and not in remission. However, I'm thankful for individuals such as yourself and others. Yes, I don't blame you. I hate to say remission. I have never said I'm in remission because I feel like remission, you waiting for that cancer to come back. It's like
Yeah.
eventually it's gonna come back. No, I feel
Hmm.
like Lisa, if God healed me, my God does not take back a healing. So
Yeah.
yes, totally agree with that.
Yes, yes. And
Totally agree.
Lisa, I'm sure, is also doing, the things that to be healthy, right? Once you have such a scary diagnosis, it can change your perspective so that now hopefully you're doing, all the things to keep yourself healthy, have good energy, get your good sleep, and all those things, that we've talked about on your show.
Yeah. I'm still trying to get some sleep, Dr. Michelle. I
Oh,
have to get more
no.
that's the only thing I feel like I am not disciplined in. That's the
Yeah.
only thing I really feel like, and it's
How many
just
hours do you average, you think?
six,
Okay.
six, six the majority of
Six.
the time. Sometimes five,
Oh
but
boy.
I would say six the majority of the time. So I really
Yeah.
have to um, just shut it down at a certain time and be like, you know what? I know that your body is healing while you're sleeping, is doing certain
Right.
things. And if you're not getting those hours and your body is not getting a chance to go into it to repair itself. So I think
Yeah.
that would be the only thing that I would say that I'm really struggling to do is that and protein.
Yes.
Since I don't eat meat. So
Right.
other than that, I say my biggest struggle would be me just getting my sleep, just being disciplined enough to get it.
Yeah. Yeah. I
Yeah.
mean, and even, we recommend 7 to 8 hours. It's so hard because there's so many things that we're trying to take care of during the day, right? After a full day of work.
Right.
But as you said, try to, in increments, if it's going to bed 20, 30 minutes earlier, that even helps. And then there's a lot of studies that show if you could do it to take a 30-minute nap during the
I
day,
wish
but
I
if
could.
you're depending on your job, you can't do that.
Right.
But that can be helpful too because it can help lower your blood pressure and decrease the stress level. But so if you work from home and can sneak in a 30-minute nap on your lunch.
Yeah. Well, working from home, that's I can sleep late, so I don't have to get up as early because it normally takes me about an hour to get there. So at least I can sleep later when I work from home. So yeah.
Yes, yes.
Kenya says lock and loaded. I think she was talking about the information earlier about what to do.
Mm-hmm.
She also said eating to live and not eating for
Eat for the
taste.
taste.
Girl,
Yes.
yeah,
So true. Eat to live, right? And food is medicine. um, you've got to, use the food of the earth and its nutritional properties. I had my cousin staying with me, just a side note, and we were talking about food as medicine. And I had bought some beet juice, which is not the tastiest thing, but beets are very good for your
yeah,
blood pressure, your heart, blood flow, and all of that. And she suffers with high blood pressure. She was with me for a week. She started drinking the beet juice and her pressure went down. And I also told her don't stop her medication. But the
right,
point is, right, that food works, right? The foods with the dark, we always talk about the
yeah.
dark fruits and vegetables and the antioxidants and all of that.
Mhm.
So the more we can learn about how food is healing, that's key as well.
Yes, I totally agree with that. Kenya says, I have never said that. I've always said I'm a survivor. She was like, I ain't in remission. No,
Right, right,
survivor.
yes.
Yes.
Yeah, because
Uh,
that's also the power of positive affirmations and positive thinking, right? And how
mhm.
that also can affect your outlook and your
Yeah,
prognosis and all of that. I'm a firm believer, in the
yeah.
power of positive thinking.
Yes. I always say I like the word survivor, but I like the word warrior because I always think of
Mm,
David when he took down Goliath, and I look at
yes,
cancer as Goliath, and everybody was so scared, and nobody wanted to do anything, and little old David just
yes.
with little slingshots
Got
and a
his
rock,
slingshot. Yes,
yes, and took
yes.
him out. So I look at it like that we're warriors. You went through a battle, and in
Hmm.
the word warrior is war, so we went to war, and we're still here. And so
Yes,
and I'm
yes,
grateful to be
yes.
here. Lisa said, I had ovarian
Mm.
cancer and there are some things I can do better. I'm working on it.
Listen, we're all working on something, right? So as half of the battle when you talk about war. Oh, my nose, my allergies are crazy. But speaking of war, and there are always things we can do better, but recognizing that is the first step. And then figuring out what are the things that we need to improve, like sleep, like,
Yeah.
eating breakfast, increasing our protein, and making small changes, talking to a nutritionist. Google can be great for, finding out how do you get more protein when you're a vegetarian, and things like that to help.
What about, Dr. Michelle, the role of the caregiver when it comes to someone who may have mental health issues along with a cancer diagnosis? Like, I think sometimes we forget about those people who are taking care of individuals like that.
Right. So really important that, as having when you have cancer that you have a caregiver to help you. But those caregivers also can be strained as they're taking care of someone. But when you're the caregiver for someone with cancer, it's important to um, really kind of acknowledge how the cancer patient may be feeling, right? And as we talked about before, like, how are you feeling today, or you seem really sad today, right? And to say, because I know a lot of times we will say things like, if there's anything I can do for you, let me know. But it's also important to be more specific about when you want to help someone, is to say, hey, can I do your laundry? Or maybe I'll bring you, dinner tomorrow, or, things like that, to be specific, because sometimes cancer patients don't want to feel like a burden,
Mhm.
to their caregiver and friends and spouse. And so they may not speak up when they need things, but it's so important to have that support when you're going through that struggle.
Yeah, I totally agree. I looked at my mom, who was a caregiver for my sister who passed from cancer, and my dad. And I don't know. I know it was her faith that got her through all of it, but that was a lot. And the one thing that she does do, because um she has type 2 diabetes, and so what she does is she walks a lot, and by her walking, and she doesn't eat after 8 o'clock, it minimizes the amount of medicine, insulin that she has to take. So, and I see
Right.
her doctor taking her off all of this
Mhm.
medicine because she's making sure that if that's the one thing that she could do is to walk and to relieve some of the stress, that's what she does. She, you
Yes.
know, so I think it's important as caregivers to make
Take
sure
care of
that
yourself.
you can't pour from an empty glass.
That's right. That's
Yeah.
right. And I
So,
always talk about the benefits of walking for so many things, right? Stress reliever, lowering your blood pressure, weight. It's one of the best exercises. And
yeah.
walking outdoors, especially when we've got great weather.
Would that fall into the role of like holistic or integrative approaches?
That's right. Yes. Holistic, which is really the stress relieving, but meditation, you know, um, yoga, all of those things that help to relieve depression are key. Things like find out what things you enjoy doing, right? Pick up a hobby. We talk about that a lot, right? The more you can do things that you enjoy, the more you can get some joy out of every day. So think about and I will ask patients sometimes. I say, well, what's something that you always used to enjoy doing before you got sick, right? Or if there was one thing you wanted to learn or to do, what is that, right? So they can think about it, and then we figure out, okay, how do we make that happen for you? Because sometimes you think, oh, I don't have the energy to do anything, or I can't do it, or things like that. But I'll ask that question, and then I say, well, how do we make that happen? What is the thing that would, allow that to happen so you can get some joy out of every day,
Yeah,
right?
absolutely.
Hmm.
Can you think of, Dr. Michelle, any type of long-term psychological effects that maybe a cancer survivor may face or may be dealing with, even long after they're done?
Yeah. So sometimes, as you said before, right, they can still, because there's some cancer agents that have long-term side effects, and sometimes the cancer agents can cause depression. Some can even cause psychosis, right? And hopefully, once we stop that medication, those symptoms go away, right? But the long-term depression, fatigue can
Mm,
be ongoing for some
yes.
time, and the important part is really recognizing that there's something different, and talking to your provider about how do we address that, right? If you're still feeling fatigued long after your cancer treatment, first of all, we should be checking blood work to make sure there's not a physical reason that that's the case that can be corrected. Are you anemic? Are your kidneys okay? And all of that. If that's all good, then sometimes depression will mask itself as fatigue and tiredness. And
Mm.
again, we've got our questions that we ask to elicit, is this really depression? That seems like just fatigue. And then we can address that.
Wow. So you may think, oh God, it's just from the cancer long-term effects, but really is it could be depression.
Yes.
So when in doubt, go get it checked out.
Yes, and we always talk
Yeah,
about that, right?
yeah,
It's great to have your sister network to kind of talk things through. But as your doctor mentioned, if you're having some symptoms and they're lasting 3, 4 weeks and it's not going away, we need to, come in and talk to your provider so we can figure it out for you, right? Some things can be, short term, but anytime someone tells me that they've been feeling a certain way and it's been 3 to 4 weeks and it has not resolved itself, that's when I've got to go and dig deeper. Sometimes it's digging deeper with blood work, but sometimes it's the history, the questions, right? To get to that. But the point is really, when you have gone through cancer and going through cancer, it's completely normal to feel sad, depressed, angry, stressed out, any of that, right? And sometimes we might think, I feel that way and I have cancer, so I just have to deal with it. But if your provider isn't asking certain questions, because they're so focused on the physical and the mental are intertwined. And
yeah,
sometimes we have to
yeah.
bring it up ourselves.
Yes, I'm glad you said that because I really believe that they should be balanced. So if
Yeah.
one of them is out of whack, then how can you truly have healing, total healing, if one part or one component is not working properly? So yeah.
Yeah, yeah, because we know that when you have poor mental health, it affects your physical health. And the
Mhm.
same, poor physical health affects your mental health. They're all intertwined. And, even people who are living with chronic, diabetes, heart disease, they are also suffering with depression. And sometimes
Mhm.
they think, oh, I just have, I feel down because I have heart disease, which is making me feel tired and I can't do the
Mhm.
things I used to. But there's a component of actual depression underlying that. And if you can lift the mood, then you feel
Yeah.
more motivated to do the other things that need to be done, like exercise, right? Like eat right.
Right. That's true. And we
Mhm.
talked about at the beginning of the show about the stigma. So if someone comes to you, or if you ask someone how they're feeling and they tell you um, they feeling a little depressed, or they haven't been feeling like themselves, like, don't dismiss it. Try to dig a little deeper, like Dr. Michelle said, and try to figure out what's going on and how you can help them um, figure out what's going on to get to the bottom of it. Because a lot of times we'll be like, "You all right, girl? You just need to go shopping, or you need
Right,
to do this," and we
right,
dismiss people. Then they don't want to
right.
open up to us anymore, anybody else.
Good point. Good point. Because sometimes we ourselves are uncomfortable with the fact that someone else might be feeling a
Yeah.
certain way, right? So we sort of ignore it. And it's hard for us
Mhm.
to acknowledge that the other person might be feeling depressed, right? Because it's uncomfortable and we don't know how they're going to react
You're right.
to us bringing it up, right?
Mhm.
But it's important to even though it's not a comfortable conversation sometimes, that if you're the one that's noticing someone is feeling down and depressed, to don't ignore it, right? We started with suicide in cancer patients is great. And whether you have cancer or chronic illness or no medical illness, but you're feeling
Mhm.
depressed, right? It increases your risk of suicide if your depression is untreated. And so ignoring it, is not the answer. And we have to help those who are going through it as best we can.
Yeah. Now I know you probably already answered this already, but what words of wisdom will you give to somebody, a cancer patient or someone who's dealing with a chronic illness that feels overwhelmed by both their diagnosis and their mental health?
Yes, it's normalizing how you feel and knowing however you feel is okay, and that it's important to talk about it, right? Because having cancer can be very overwhelming. You're going through a lot of, physical treatments and body changes, and all of that can definitely affect your mental well-being. Um, as we always say on your show, is to not suffer in silence. Talk to someone, find a trusted friend that that if you say something, they'll take it seriously, and speak with them, right? Because I have provider friends who I'll hear that they have a doctor friend who has committed suicide, and that's always very disheartening and upsetting to me, even as a professional. But the important thing is to not ignore your symptoms. Find a trusted friend, talk to your provider. We are removing the stigma of mental illness, and making it a normal part of conversation. If your doctor isn't asking you, find a new doctor because they should be asking.
Yes, thank you so much, Dr. Michelle, for those words of wisdom. And can you tell everybody how to stay connected with you?
Yes, they can find me on Facebook at Dr. Michelle's Healthy Life Solutions or Doc Michelle. And I am available for any speaking events, to speak regarding health and wellness across the Chicago area.
Awesome. Thank you so much. As always, you never disappoint us every single month. So I appreciate your words of wisdom and experience that you have. And I'm hoping that everybody has taken notes and just apply it to your life. And we're not asking that you do it all at one time. Just, you know, make it a daily decision. So
Yes,
thank you so much. I always appreciate you, Dr. Michelle. Thank you.
absolutely. Thank you for having me.
You're welcome. I want to recognize my sponsor today, Gloria Dotson with Mary Kay. She's catering to all of your beauty needs from head to toe. You can go to marykay.com/GDOTSON and let her know that Warriors Talk sent you. Warriors Talk is always looking for individuals to share their story. If you have a story, a survivor story, and you want to share it, please inbox me. I'm ready. Or you can email me at warriorstalk1@gmail.com. Warriors Talk is getting ready to celebrate our 8th annual Survivor Celebration of Reflection Gala. This is year number 8. This is our season of new beginning, and it's taking place on October 19th, 11 a.m. to 3 p.m. at the Crystal Sky Banquet Hall in McCook, Illinois. We are looking to award survivors, a warrior in battle financially, and then we also crown a Survivor of the Year. Our survivors are always free to attend this event, and we're looking for sponsors to actually sponsor a survivor so that they can attend the event for free. Right now, I have an early bird special going on, and the tickets are $40. After September 13th, the tickets will be $60. So I will see you on the 19th. And you guys, I want to make sure that you connect with us every single week. We will be live on Intellectual Radio at 6 p.m. every single Monday night. And I will leave you with these words of wisdom. Your mental health is everything. Prioritize it. Make the time like your life depends on it, because it does. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.